Big story this morning addressing mental health and suicide awareness as Arizona schools are settling into a new year. A series of devastating losses are impacting the East Valley.
Just last night, a vigil held in Chandler for a former Perry High School student. This latest death comes after at least 3 other teens died by suicide in Chandler at the end of the last school year.
Team 12's Jen Wahl is joining us live in Chandler right now, where concerned parents and students have been pleading for help from the community. Jen, they're planning to come out again tonight. Is that correct?
Yes, good morning to you. We're expecting to see students and therapists as well as mental health advocates coming here to the Chandler School District Governing Board meeting tonight. They're expected to ask for more support when it comes to mental health issues they're seeing within their schools. Now, this is not the first time this topic has been addressed by these students. They were here just 2 months ago at a governing board meeting in June asking for the same support.
On an early June night, while many Valley families were enjoying their summer break, these students were standing in front of the Chandler Unified School District Governing Board, giving district leaders an inside look at the mental health struggles students are facing.
In the past few years, I've struggled with mental health and watched my friends struggle with it. And as I'm sure many of you know, it's so hard to watch someone you love go through something like this.
One of the Chandler voices addressing the board in support of those students is Chad Day.
It's so brave of them to come in here and have to ask for this. It's a shame that they have to come in here and ask for this.
He says he lost his son Pearson to suicide just weeks prior.
And I will be here to help you get what you guys need in your school systems. Whether it to be fundraising, whatever it needs, no parent should ever have to go through this.
Pearson's death and at least 2 other teens who reportedly took their own lives in Chandler in May, bringing students like Chandler High senior Rihanna Alexander together in an Arizona Students for Mental Health group. Rihanna knows the struggles mental health can bring firsthand.
I actually unenrolled from Chandler High and I had to transfer online for the second semester of my junior year. And then I got help from a mental hospital in Copper Springs in Gilbert. And then, family and friends helped me get better as well.
Rihanna says she's doing better right now and is back to school in person part of the time. But her experience also brought her in front of the CUSD Governing Board back in June, asking the district to step up mental health support she did not feel she had enough of.
Our organization, Arizona Students for Mental Health, is advocating for a change.
In an interview with 12 News, Rihanna says her group wants every junior high and high school in the district to have student representatives meeting monthly with district leaders to talk about mental health needs within their schools. We reached out to the district to find out the status of this request. In an email sent to 12 News and Chandler families, the district says Chandler families will soon see student roundtable discussions, student-led support groups at the secondary level, a community forum, and increased resources at school sites. Rihanna's student group also asked for all students and staff to go through mental health first aid training to recognize suicidal ideation signs. The district told 12 News the superintendent was not available for an on-camera interview to follow up, but in an email to 12 News said in part, last year more than 800 staff and community members were trained in youth mental health first aid. More staff training is coming this school year. And in that same email, Chandler Unified says they're working to implement teen mental health first aid for ages 15 and up, and parent approval is required. Prior to 12 News learning of these serious concerns brought up at the June board meeting, we talked on camera with Chandler Unified's Director of Counseling and Social Services, Brenda Vargas.
It takes all of us to support our children.
She says the district has roughly $5.5 million in funding for mental health resources. Part of that has been used to hire 2 new positions this year, a prevention coordinator with a background in social work and a director of safety.
So that we can make sure that as students are coming to school every day and facing the multitude of challenges that they feel safe in our facility.
Vargas says the district is providing more tools to families like the free A Friend Asks app, which gives tips and information on suicide warning signs. There's also the new 988 federal suicide hotline. local Teen Lifeline, and CUSD's Speak Up for Safety line.
If someone is facing, a challenge and or supporting a friend that is having a challenge, we know that the way that our students stay connected is globally through that cell phone that gives them access. It's quick, accessible.
While the Chandler School District takes action on youth mental health support, Phoenix Children's treats patients across the valley. The hospital says it's seen a marked increase during the pandemic in families seeking behavioral health services for their children. In 2020, the Arizona Department of Health Services reported 49 suicides in Arizona youth 17 and younger. That's a 30% increase from 2019.
Yeah, and tonight here in Chandler at 5 p.m., the district tells me that they're going to have a study session where many of these mental health issues that we've addressed will be discussed. So stay with 12 News for updates on that. And then again, the Arizona Students for Mental Health organization is expected to address the governing board during its meeting once again. All right, let's go ahead and send it back to the studio now, where Scott is going to be joined with a local child mental health advocate. She's really dialed into all of these issues going on in the East Valley right now. Scott?
Jen, thank you. Yeah, we're going to talk to her right now. In studio this morning, youth mental health advocate and educational professional Katie McPherson. Katie, thanks for being here.
Yeah, thanks for having me.
You saw that important and impactful reporting from Jen. Let's talk about help. Is there enough help? Are there enough resources out there for kids and teens who are facing mental health challenges or even mental health crisis? Will there be enough people on the other end of the phone to answer and give help if somebody calls?
We do have a ton of resources. It's just getting the word out about them. We are 44th in funding for this type of thing, so we are lagging behind nationally, but we do have a ton of resources for families and students.
And for families looking to get some of that, what's the best place to go? Where do they start?
I would start with your pediatrician, doing a depression screener, an anxiety screener, really dialing in with your family pediatrician. Also in your community, looking at church resources, school resources, as well as local nonprofits like Not My Kid, Community Bridges, Teen Lifeline.
What if a family out there, student, teen, is struggling right now and they need to go somewhere to get some help? I want to ask you about facilities, beds. You know, we've heard stories here in the Valley of kids, teens struggling to find a bed in a mental health facility, so they have to go to the ER and stay there for multiple days, which is a safer place, Katie, but not the best place.
Yeah, we have some great facilities. We have 5 or 6 of them in Maricopa County. Honor Thunderbird, Honor Scottsdale Osborne, Honor Desert, Oasis, and Aurora, and Quail Run. So we have 6 across the valley to help students. I'm not going to lie, we only have about 230 beds countywide, and we have so many tweens and teens that unfortunately are stressed and having acute distress. So we are on a wait nightly for beds.
Let's talk about some of the reasons and maybe some of the driving factors why. We know the pandemic was really tough on a lot of kids and teens. Isolation, not being able to hang out with their friends. What are you seeing? Social media, is that playing a role?
It's definitely a factor, but everyone wants to blame the phones and social media. It's much more than that. We have genetics, we have home environments, we have substance abuse, we have families that are really stressed, and that was prior to the pandemic. We have academic stress, athletic pressures, we have students that are seeing mass shootings bi-weekly, and that is impacting who they are and how they show up in schools feeling safe. So it's a multitude of factors.
You mentioned substance abuse, so let's talk about that. That can be a place where a lot of people get stuck. You know, somebody who's facing mental health challenges and also addiction, trying to go to maybe a detox to get help, but being turned away because they have mental health issues or maybe some psychiatric issues, or those folks who are facing addiction going to a mental health facility being told, hey, you got to detox first before you come here. So they're really in a rut. And that's at a time when they're reaching out for help, which, as you know, Katie, can be really tough to do, to make that decision, and then to be turned away is extremely
it's devastating.
Yeah.
The good news is we have a couple of facilities that do this for a living, so to speak. Not My Kid in North Scottsdale Scottsdale has an outpatient substance abuse clinic for youth specifically. They do wonderful work there, both virtually and in person. Tons of resources, Community Bridges and Mesa. So we do have the help, but the key is early intervention. Parents and caregivers have to go as soon as they see an issue and not wait until students are in acute crisis.
Right. So for a family watching right now, what's your advice to them if they need some help?
Do not avoid pain. We have to face it and we have to intervene as soon as possible so that we don't get down that runway.
Oh, Katie, thank you so much.
Yeah.
Really appreciate it. We really can't talk enough about this issue. Hopefully we can have you back and keep the conversation going.
Yeah, absolutely.
All right.
Thanks.
Appreciate it.
Thanks.
Emily, over to you.